So guys, October is Breast Cancer Awareness Month, and as my routine is, every year I do a video on breast cancer awareness. Some of the statistics have changed, some have remained the same, but this time around I'm coming to you with a personal experience, and that is one of the reasons why I'm using this channel to educate and to make sure that the world is informed about what might be going on around us or in our own bodies. So if you're tuning in for the first time, my name is Claudine. I am a nurse practitioner by profession. I am a wife, a mother, and I use this channel to bring content that's meant for education, to encourage, and to even just learn more about me. So before we ramble too much, welcome to my channel, and please consider subscribing, turn on your notification bell so you are notified every time I upload a video. So as we mentioned in the beginning, October is Breast Cancer Awareness Month, and this time around I want to talk to you guys about just the basics of breast cancer awareness. So if found early, 90% of breast cancer can be successfully treated. And this is when it hasn't spread to different parts of the body or it hasn't spread further onto the breast area. So how do you get to know yourself? One thing you need to know is get to know your breasts. And we're going to use the basic terms here. Nothing extensive, something you can know as an individual or even for your partner to be aware of. So some of the things is nipple changes. So things like discharge, any breast discharge unless you're lactating is not normal. Pulling in, meaning the nipple pulls into the body, like it's not the extensive poking out nipple. Changes in the direction. So instead of the nipple being right in the middle, it moves to either the left or the right or the top, or it pulls down to a different direction. Any ulcers around your nipple, any kind of scaling, which is an abnormal dryness around the skin, around the nipple area, that's not normal. So how do you know, or how do you look for and feel these changes? So things like discoloration. You know the normal color of your nipple. So if you see any discoloration around your nipple area or your breast, make sure you check it a little further by seeking professional guidance. So a lump in the breast. And this is a gray area. Sometimes you can feel the lump, sometimes you cannot. But if you feel a lump in your breast, especially when you're doing that self-exam test or self-examination on yourself, that is a sign that you need further evaluation. Swelling, and this can be felt, this can be seen, or anything in your lump or your armpit. So let's say you feel something around your armpit area. It could be a lump that's moving out of your breast area or to the extensive side of it. Make sure you get this checked out. Orange peel texture. So you know the breast is normal, texture soft, smooth, baby-like, but when you start feeling the orange peel texture, so this is the roughness around your breast area, definitely that's something to check on. And then dimpling. Dimpling means there's like a little sunkening area. I'm trying to explain it in a normal layman's language, so that's something to watch for. So how do you know what your risk factors are? So risk factors can cut across generations, ages. So anybody 25 and under, you need to ask your doctor for a breast cancer risk screening or assessment to find out if you're at an average risk or if you're at an increasing risk. I recently talked to a 21-year-old and I was like, at 21, you're already having your menses. So it's good to get that basic screening to see what your risk factors are. And then anybody from 25 to 39, that's average. Consider a clinical breast exam every month or every 3 years. You get a professional examination. At age 40 and older, consider mammogram and a clinical breast exam every year. So if you're watching this and you've not gotten your wellness evaluation and you're 40 and over, and this means you got your OBGYN, you get your wellness woman, your pap smear, your breast self-exam, your mammogram, I would definitely recommend that you get that done as soon as possible. So if you're at an increased risk, or if you've been told that you're at an increased risk for breast cancer, ask your doctor for individualized screening plan. So this is one of the statistics there, that Black women are more likely than other women to get aggressive forms of breast cancer. So reports of these symptoms can help you decrease or delay your chances of getting the evaluation. Okay, so I want to pivot and talk about dense breasts. So what does it mean? It means you might need more screening than normal. And that's one of the things I needed this year. And they recommended, because when you do regular mammogram and you have dense breast tissue, meaning they're not able to see everything that they're trying to see. So you may require additional screening, so like ultrasound, or they may require a different view of your breast just to make sure they're not missing anything. So breast density matters because cancer cells can be hiding in places or in masses that they cannot be able to visualize through the normal process. So you're probably wondering, are dense breasts common? And yes, the answer is yes. 40% of women in the United States have dense breasts. So this year I required additional screening because of dense breasts. So I'm one of those 40%, and who knows who's also watching, who's part of that. So it's more common if you're under 50, and that's where I fall. So anywhere between 40 to 49, you probably have dense breasts. And if you're pregnant or breastfeeding, that's one of the common factors as well. Or if you have a lower body weight. And that's really could go both ways, because obviously I don't have a lower body weight, but that's one of the risk factors. And the other risk factor is if you're taking hormone replacement therapy. So that's one of the things that you really need to watch for. So my point today is, always make sure you get your screening done, because the earlier the screening, the earlier we are able to detect if there's any abnormalities, and the sooner you're able to get any recommended treatment, whether it's surgery, whether it's biopsy to just confirm it, or whether it's watchful waiting, which can be very, very detrimental. And so today my goal was just to come on here briefly and talk about breast cancer awareness, because teach one and another person will definitely learn out of it. So my passion for this was just to make sure somebody is more aware of what is involved in breast evaluation, and not just in October, but throughout the year, making sure we take good care of ourselves and making sure we educate our peers, our family members, or even our friends on what breast evaluation involves. So thank you so much for joining me today, and I hope you can take good care of yourself, and I hope you can educate somebody else. Thank you for joining me.